Hello YouTubers, I hope you feel well today, and I hope that you are watching this video and you feel happy and healthy and energized. And I hope you're ready to dive into a very well studied complication or condition of pregnancy. There is a lot known about this particular complication or condition, as it is widely studied, analyzed, and has been written about all over the world. Fetal growth restriction. So now let's readdress the idea of blood flow being compromised, affecting baby's growth rate, affecting a cryptic baby's growth rate because of scarcity in nutrients and HCG in a cryptic pregnancy. The new cryptic pregnancy theory, or protracted gestation theory, is that a retroverted or retroflexed uterus can theoretically restrict HCG from entering the bloodstream and limit the amount of nutrients that flow to the placenta, creating a longer gestation time. These women claim that the live cryptic babies born within the cryptic pregnancy community are of normal size and completely healthy, with absolutely no deficits or disabilities, no negative side effects from the months of limited resources at such an early stage of development. But if you think about this realistically, essentially, even theoretically restricting HCG from entering the bloodstream and limiting the amount of nutrients that flow to the placenta, this is the description and definition of fetal growth restriction. This means it affects the baby's health and development directly, and we know this due to tons of studies. This is a serious condition. We have already discussed how an untreated incarcerated uterus can result in major complications for both the mother and baby. So decreased blood flow to the placenta may mean your baby is suffering from fetal growth restriction, and the negative implications it would have on the baby to go months without adequate materials to build the genes and chromosomes needed to sustain life within the womb would be tremendous. So from the Cryptic Pregnancy website, Cryptic Pregnancy, a Hidden Blessing, it says, cryptic pregnancy could be an adaptive pattern of forced cooperation between mother and fetus in stressful or threatening ecological circumstances, as suggested by the reported association with elevated psychosocial stress. In case of reduced survival probability, both mother and fetus would benefit if the mother reduced investment in pregnancy in order to maximize her chances of surviving and reaching delivery. So my question is, who's the reported association? This is essentially promoting the theological view that a woman can not only control but manipulate the resources in which she gives her unborn fetus in utero, while also stating that the woman's body will ultimately sacrifice its own health and life to keep a baby alive. They are ultimately claiming that they have developed the ability to bypass the body's natural process of abortion. Forced cooperation does not happen between a mother and a fetus. This is why complications such as miscarriage, stillborn, and spontaneous abortions happen. This is the body's natural process and the only way it functions. So let's quickly cover what fetal growth restriction is. So many things increase the risk for fetal growth restriction. These include problems with the placenta or the umbilical cord. The placenta may not attach well to the side of the uterus, or the blood flow through the umbilical cord itself may be limited. And then there's factors in both the mother and the baby that could cause fetal growth restriction. Factors in the mother that can cause fetal growth restriction include high blood pressure, diabetes, anemia, long-term lung or kidney problems, autoimmune disease, very low weight or obese, poor nutrition or poor weight gain, alcohol or drug abuse, and cigarette smoking. Factors in the baby that could possibly cause fetal growth restriction during the pregnancy include being a twin or triplets with a multiple pregnancy, infections, birth defects such as heart defects, problems with genes or chromosomes. So it's important to note that there is no mention of position of uterus or no mention of an incarcerated uterus posing a factor that can cause fetal growth restriction. A baby with fetal growth restriction may have certain signs after birth, such as a low birth weight, low blood sugar levels, lower body temperature, high level of red blood cells, and trouble fighting infections. Those are just a few of the complications a baby with fetal growth restriction can have after birth. Fetal growth restriction is easily diagnosed, and the reason why the mother's weight is monitored and why the fundal height is measured is to make sure that the baby is growing properly. And it can be diagnosed pretty easily through ultrasound in a Doppler ultrasound. Treatment depends on how serious the fetal growth restriction is, and it's based upon the ultrasound, estimated fetal weight, and Doppler ultrasound, which measures the blood flow to the baby. And then they take into account risk factors and the number of weeks gestation the pregnancy is. So they take all of this into account. Sorry, my son is yelling at his brother. Treatment may include frequent monitoring, so your doctor will want to see you for more often prenatal visits. You will have more ultrasounds. They will probably recommend quite a few different kinds of tests. They will ask for you to track fetal movements once you're able to feel the baby moving inside of you. They might suggest corticosteroid medicine. They might suggest a hospital stay. An early delivery is a possibility, and if you have fetal growth restriction, an emergency cesarean is a high possibility. So what are possible complications of fetal growth restrictions? Fetal growth restriction can cause many serious complications. You may need to be delivered early and stay in the hospital. The baby may need to stay in the hospital after birth. Your baby may have trouble breathing or have infections or other serious problems. Stillbirth and death may occur. That's one of the risks of this complication. And then as your child grows, he or she will be at higher risk for heart and blood vessel problems. So how can fetal growth restriction be prevented? Honestly, it can happen in any pregnancy, but the woman can take precautions in order to reduce her risk, such as not smoking cigarettes, not drinking alcohol, keeping a healthy diet, and making sure she's at a steady weight. Many factors increase the risk for fetal growth restriction, and they may be related to the placenta, mother, and the baby. But there is very little evidence supporting the position of the uterus having any increased risk of fetal growth restriction. So estimating fetal weight with ultrasound is the best way to identify fetal growth restriction and can be easily diagnosed and easily monitored. I also want to express again that in fetal growth restriction, the chance of a stillbirth is extremely high. Fetal growth restriction requires medical intervention for the pregnancy to progress healthily and ensure the safe delivery of the baby and the safety of the mother after delivery. Besides having high perinatal mortality rates, these infants are at higher risk for severe adverse outcomes, such as hypoxia ischemia, encephalopathy, and cerebral palsy. Moreover, reduced fetal growth has lifelong health consequences, including higher risks of developing metabolic and cardiovascular diseases in adulthood. So essentially, the new theory these women have come up with for an extended gestational pregnancy are 3 medical diagnosable conditions called an incarcerated uterus, intrauterine growth restriction, and fetal growth restriction, all of which have been extensively studied to have higher risk of mortality if no intervention is performed. This theory is a huge stretch to be an actual responsible or even a logical explanation for an extended gestational pregnancy. These 3 complications have been studied for decades, and we know the exact outcome of a baby born with intrauterine growth restriction or fetal growth restriction due to lack of blood flow and nutrients. Depending on when the diagnosis and treatments were given, if the mother does not seek medical intervention for her fetal growth restriction, the outcome does not look good for mother or baby. If you are pregnant and think you might have intrauterine growth restriction, or you think that your baby might have fetal growth restriction, it is important for you to see a doctor as soon as possible so they can diagnose you and you can be monitored closely, and possibly they can come up with a treatment plan for you. So I hope this video helps someone. There is a lot of confusing information out there, and it is always good to continue to ask questions about everything and get all the information you can from a truthful source. So I thank you guys for watching. I hope you have a great day. Make sure to have some fun today and be safe, spread love. I'll see you next time. Bye. Thank you.